In a slum community on the east side of Nairobi, Kenya, accessing proper eye care is difficult, if not impossible, for the tens of thousands of people stuck here because of poverty.
Straight up.
Today, a team of Canadian eye doctors and other volunteers have come to offer their skills, their equipment, and their free glasses to those in need. The patients wait patiently for their turn to see an eye doctor. Every eye doctor takes on a different piece of the exam routine, patients moving from one doctor to another. The patient's last stop is a table where glasses are provided, if the proper prescription is in the bags of pre-made glasses that the team members have brought with them. If the right glasses don't exist here, new frames and the prescriptions are sent off to the nearest lab, paid for with donations to Canadian Vision Care. Living in a slum environment without proper eyesight is difficult. Children can't succeed in local schools. The elderly struggle to find their way from day to day.
Are you seeing better?
I'm seeing better.
Okay.
People like Florence Lebende Nyamamu. She's 72 years old. These glasses have changed her life, she says. She can read again, take care of herself. It's a story these Canadian Vision Care volunteers hear time and time again.
It is an opportunity to give back in an area that I know how to give back. But even more than that, the people that we go with, the volunteers that we travel with, it's special. We all have that desire to help others, but we also recognize that this trip is as meaningful for us as it is for those that we serve. We get to see parts of the country that we never would be able to see as tourists. But also the satisfaction. One of the things that we have more recently gotten to see is the times when people pick up their glasses or have had their surgery done. And that's really special to see that our impact was so powerful on the other end. Oftentimes we go there and we don't get to see that part. We help them, but we don't get to see the final part. So that was also unique on this most recent trip to Africa, where we got to see footage of the latter.
In an orphanage on the other side of Nairobi, children and those living around the orphanage are given the same opportunity to get the eye care they need. And in rural Kenya, the Maasai lands, many have never seen an optometrist. The need is big. Sometimes the problems are as well.
Okay.
Dr. Charles Sharia, the lone Kenyan on the team, does cataract surgeries mostly. And there's no shortage of patients out here.
Oh yeah, no, I can totally feel the difference. Yeah.
Across this dusty part of the savannah, there are community schools that seem to just pop up among the acacia thorn bushes. They become the center of Maasai communities.
Right here.
And the place where eye doctors go to see their patients.
She sees better one eye close up, and better on the other eye, far.
These volunteers have left their own practices in Canada and paid their own way to get here.
My most recent trip was to Kenya, the country I emigrated from at a young age. So for me that was very special to go back and see the country that I never knew, because I left when I was so young. So not just the tourist side, but the parts that we would never have been able to see had it not been a trip like this. The underprivileged areas, but also areas that were in need of care. And I think what was even more special for me was seeing the people on the ground that cared as deeply or more deeply than I did, that helped with people every day that didn't have the means to help themselves or were in positions where they couldn't. And so for me, the part of the trip that I really enjoyed the most was meeting those other fellow volunteers that had less means and less ability and still did so much for their community.
There are still hundreds of millions of people in some of the poorest places in the world who have low vision or no vision simply because they don't have access to an optometrist. Canadian Vision Care is doing its part to change that through private donations to acquire equipment and glasses, by creating education programs in the developing world, and through Canadian optometrists volunteering their time and their skills, as they've been doing in Kenya and beyond. If you'd like to support the work of Canadian Vision Care through a private donation, please visit our website, canadianvisioncare.com. And CBC welcomes more optometrists to join their outreach teams and be part of the international eye care solution.